Hello, my name is Jessica Pierce and I will be presenting on low back pain in athletes. Low back pain is common in both the general population and athletics. In the general population, there is a reported lifetime prevalence of 85 to 95% for low back pain, with 2 to 5% of the general population experiencing low back pain once per year. Low back pain in the athlete can cause limitations in both athletics and daily life by limiting the ability to perform and affecting quality of life. Low back pain has been cited as one of the most common causes of lost playing time, with approximately 1 to 30% of all athletes experiencing low back pain. For this study, there were 5 male Division I college athletes between the ages of 20 and 22, whose sports included men's basketball and wrestling. Only one of the 5 athletes reported previous low back pain on their incoming physical. 2 of the athletes have had surgery on the low back in the last year and a half. 2 of the athletes are currently participating in their sport, and 3 are not. And their diagnoses typically involved the L4, L5, L5S1 discs. This is a picture of the ICF disablement model applied to the group, including all categories that may be relevant to all involved injuries. The 2 PROs I have chosen to fit within this framework are the SF12 and the modified Oswestry. The SF12 was developed by Ware et al. As a shortened form of the SF36. It was found to have similar precision as the SF36. It's comprised of 2 component scores, the physical component score and the mental component score. It's proven to be reliable, valid, and responsive in patients experiencing low back pain. It is also recommended for use when time is a factor and patient assessment can focus on the physical and mental components of an injury. It's comprised of 7 total questions and 12 total items for scoring. Scores range from 0 to 100 for both the PCS-12 and the MCS-12, with higher scores reflecting better health. Mean score for both components is 50. The MCID for both instruments is how I measured if clinically significant change occurred. The MCID for the PCS-12 is a change of greater than 3.26. The MCID for the MCS-12 is a change of greater than 3.77. The modified Oswestry is a 10-item questionnaire that focuses on how low back pain affects daily activity. It has been found to be valid, reliable, and responsive to patient populations experiencing low back pain. Each item is rated from 0 to 5, with the total score multiplied by 2 and expressed as a percentage. The MCID for the ODQ is 6 percentage points, with a higher score indicative of higher disability. Data was administered at the beginning of the athlete's treatment session with their respective athletic trainer, usually while the athlete was receiving modality treatment. Both the PROs were administered via paper and pen because it was easier for the athlete while they were on the modality. I was typically nearby if the athlete had any questions or had trouble understanding something. The second administration occurred 2 to 3 weeks later, depending on the athlete's schedule. The ODQ was easily scored by hand, while the SF12 needed to be scored by computer due to the complexity of the scoring procedure. I expected to find that decreased ODQ scores would have a corresponding increase in SF12 component scores, with a reflected change that would be above the recommended MCID. So what did I find? For ODQ, athlete A, C, and D had improved ODQ scores, while athlete B and D did not. Athlete B and D are the 2 athletes that are currently participating in their sport. And interestingly enough, both athletes had begun traveling for the regular season the week prior to the second administration, and both cited increased pain with travel. We typically take buses when we travel at our division level, and that can definitely cause some increased back pain when you're having issues. Athlete A and C both had ODQ scores that increased beyond the MCID, and both of these athletes were the 2 that have had surgery within the last year and a half. As a group, the average ODQ score decreased by 2.4%. PCS-12 scores for all the athletes except athlete D reported an increase. Athletes C and E reported an increase beyond the MCID. And athletes A and B reported an increased score that did not reach the MCID. Athlete D reported a decreased score of only 0.5, which actually kind of indicates no change. On average, the group improved by 4.76 points, which is above the recommended MCID. For the MCS 12 scores, all the athletes showed a decrease, except athlete E, and on average, the group reported a decreased score of 1.86. So did the findings support my hypothesis? No, none of the athletes experienced changes that completely reflected the hypothesis. In fact, most of the athletes experienced a decreased MCS 12 score even if they experienced an increase in one or both of the other scores. Overall, I found this to be a very interesting project. I've never used a formal PRO assessment as a part of my clinical practice, but I can see the benefits that they provide. I found that the athletes were interested in what I was trying to accomplish and felt that they were being listened to and included, which I think encouraged them to give me more honest answers than they may have originally intended to. Even though the SF12 was harder to score, I believe both of these instruments could be added into my clinical practice, as both were beneficial in getting beyond just the clinical measurements that we typically take. The biggest barrier I noted was working with the athletes' schedules. It was a little hard to get them in once their competitive seasons had started. What I found interesting was that 4 of the 5 athletes experienced a decrease in MCF 12 scores, regardless of the increase in one or both of the other measurement scores. I believe this is an important finding that may not have been noticed without the PRO measurements. This can help further discussions with the athlete on what may or may not be the cause of the decrease in their emotional health so that new strategies and goals can be discussed and a possible referral for counseling can be made. Thank you for watching this presentation. I hope you found it helpful. I wish all of you good luck in your classes and a happy holiday season.